Okay, so now we're getting into the elbow. All right, so then kind of to follow the same kind of patterns, what kind of, first you're going to have acute injuries. So what kind of things could those be? I mean, mechanism of injury. Push, you can fall this way, you can get your arm pulled in a weird way or something like that. So acute traumatic injuries, what kind of things are you looking for? What kind of injuries? Fractures, dislocations, sprains, and they're tissue injuries, right? So what kind of tests can we do for those? Yeah, so for the ligaments. I'll tell you what, I've already done these tests lots of times. Does somebody else want to come up and practice them?
I think that it would still be really beneficial for us to
I mean,
see
I
you
can
do
still
that.
do them, but also somebody else can practice it. But so you can also practice it amongst yourselves too, because a lot of times what people say is that we need to have time practicing the test. So we're going to try to do that. But I mean, I'm running through it too. But if somebody wants to come up and practice them at the same time too, you can do that, and I'll still show them to you too. All right. So valgus. There's different places where you can contact. Typically, you're going to be contacting a little bit distal to the joint. You can do it up here like this. And then basically, you're going to have the line of drive is going to be perpendicular to the ligament. So ligament's over here. So we're going to press like that. Okay? And then we're going to do the other one over here like that. Okay, so which one is this? Varus, because the distal part of the extremity, is it moving towards the midline or away from the midline?
Towards.
Towards. So is that varus or valgus?
Varus.
Okay. And then what ligament is it?
Radial lateral.
Okay. So then what other things can you do for nerve tissue? So that's for dislocations. Yeah, so you can percuss. You can do it over the area where you might suspect there's trauma. You could even do it like this. Something like that. You can feel pain in here, or in this case, we're talking about the elbow. All right. Okay, anything else for acute injuries? No. All right. Then what's next? Okay. So what are the main different muscle groups that we have for that? Yeah, flexors, extensors. So how are we going to test contractile tissues? Active range of motion, or if we're getting into special tests, we're going to do what? Stretching at the end, or resistant contraction. Okay. So talking about lateral epicondyles, wrist extensors. Hold up like this. Don't let me press your wrist down. Okay. So what's that? All right. So that's active resistant. All right. So then passive at the end of range. Okay. And then don't let me press this finger down. Okay. So then we talked about this. What's left? Yeah. Okay. So there's only one test we learned for that. Is it contracting the muscle or stretching it at the end of the range? This, like this. Don't let me press the wrist down like that. Okay. Golfers all test. So basically, it's contractile. It's active resisted range of motion, basically. Okay. So again, you can try it with the elbow extension. You can try it flexion, but typically it's going to be supinated, and then it could even have a little bit of radial deviation because you want to accentuate that stretch. So the farther you go over here, the more you're pulling on that muscle. Okay, so you could also, just relax. You could also do passive stretching at the end of the range. That one's not in the notes, but you can understand the basic concept, right? We're just doing stretching it at the end of its range. Okay, so then we did inert tissue, did contractile tissue. What's left? Okay, so what are the neural things for
Tapping on the nerve.
So yeah, same kind of thing. What do we do for nerves? Tap on the cubital tunnel, which is between the olecranon and the medial epicondyle. Okay, that's another thing on the other quiz. What bone is the medial and lateral epicondyles on? What bone is it? What bone is this? Is it the humerus, the radius, or the ulnar? You have the humerus, right? You have these epicondylar ridges. The epicondyles are on the humerus. Okay, when you talk about the triangular alignment, you have the epicondyles, which is part of the humerus, and then the olecranon, which is part of what bone? Right, because some people were saying that it was the radius and the ulnar, but it's the epicondyles are part of the humerus. The wrist flexors and wrist extensors also go across the elbow joint. So the epicondyle is part of the humerus. What was that? Okay, so yeah, we did so toenails. All right, so we tap on nerves. Then there's not really a test that you can do to restrict the opening, so what does that leave us for a test?
Stretching.
Okay, so how do you do that?
Oh my God. And
what's that called? Seated elbow flexion test. I mean, actually, that's one of the better ones that has a descriptive name. But so we were talking about in the faculty meeting is that they're trying to have names, either not use the names, but I mean, how are you going to talk about a test if you don't give it a name? But instead of saying like O'Brien's test, or the more tests you can, more names you can give it that's descriptive of the position that you put the patient in. So try to make these tests, you know, like Mills and Cousins, we might try to change the names to those so they make more sense of what you're actually doing. All right. So any other nerve tissue that we talked about in the elbow? Yeah. Okay. So what kind of history are they going to talk about? If it's a nerve tissue, what are they usually going to say? Either weakness, numbness, tingling, loss of grip. Okay, so what nerve are we talking about? And how does it get irritated or compromised? Because it's going through the pronator muscle. It's not a hard bony tunnel or anything like that. It's just where it goes through the muscle. So what are we going to do? We're going to contract the muscle. So how are we going to contract the muscle? We're going to do resisted pronation. So I want you to try to turn your palm down. I'm not going to let you, and then I'm going to extend the elbow at the same time. So what are we looking for? Numbness and tingling in the thumb and first couple fingers. Okay. Anything else? What are the red flags types of things that you have if people have an elbow? Let's say we didn't necessarily talk about with the shoulder, either shoulder or elbow conditions. If somebody has traumatic dislocation in the elbow, what kind of things do you need to be aware of?
The deformation of the...
Yeah, but what kind of things that go through there can get injured? Nerves, yeah. So if you have shoulder elbow dislocation, you could have injury to the ulnar nerve, to the median nerve, radial nerve, vascular problems. Okay.